We can sit around the coffee tables all week long and for the next month, and we can talk about who's right and we can talk about who's wrong, or we can get on with it. That's the question. History will tell who was right or who was wrong. The real question is we can't miss this opportunity to save lives, and we can't miss this opportunity to protect our health systems. So let's just get on with it.
Yeah, and earlier I have been saying 38 countries, 10 or less cases, and if you take 11 to 100 cases, you have additional 17 countries. So 17 plus 38, 55 out of 62, with less than 100 cases. And I think the figures can show us what kind of strategy actually countries should follow, that they should start from containment. And the number of cases, countries reporting more than 1,000 cases for countries. And we're saying even those countries should actually, in their comprehensive package, they should include containment. And moving from containment to mitigation without testing the containment itself in all those countries, I don't think is a wise decision. Even with more cases, more than 1,000, having a comprehensive approach is much better than having, this strategy which moves into mitigation, which to us, and this is, I hope, surrendering, I don't think is right. So we have to give it our best using containment strategy, irrespective of the number of cases. But this doesn't mean that we will not monitor the situation on regular basis. We will, and we will adjust our strategies based on that. But in terms of strategy, still, whatever the announcement would be, whether it's pandemic or not, we will still go for a comprehensive approach. But in the strategy, the combination of strategies could vary based on the situation. So that's what we're saying. And this is coming from a proper analysis of what has happened in the last 2 to 3 months after the announcement or the declaration of this outbreak, where we have seen success with containment strategy, and which we believe that it's worthwhile to continue with that kind of strategy.
There was a question on ventilators.
Bria.
Yeah, so the question about preparing hospitals for respiratory support and ventilators and oxygen is a good one. This is something that all countries need to be doing some assessments of in terms of what would be needed should they start to see cases. We do know in terms of the severity spectrum, we do know that 80% of those that are infected will have mild disease and recover. We do know that there's approximately 15% that will have severe, and another 4 or 5% that will be critical, which will require oxygen support. So there are some estimates that are coming from the clinical teleconferences, which would give some indication of 30-40% of people who are hospitalized that would need oxygen support. And those types of percentages are preliminary. Those types of percentages need to be more refined so that people can prepare for that. And then you need to take that into an assessment of what would be required within your country based on your population, based on the demographics and the underlying conditions in your countries.
Just remember, most countries, even sophisticated health systems, have very limited intensive care capacity as an overall proportion of the number of clinical beds that they have. So this is not just an issue for the South or for weaker health systems. The careful planning and use of intensive care beds is not a straightforward process. And the idea of just having ventilators, for example, needs trained technicians. ECMO and extracorporeal oxygenation is a process that requires very high levels of skill. It's not just the equipment. So I do think that countries need to focus on basic levels of care, basic support to patients early in the course of the disease so that they don't develop the more severe forms of the disease, early use of oxygen to support people, because most countries will struggle if they start to see large numbers of patients requiring intensive care. It's not a straightforward nor an easy process, and we've also seen that people are spending many days, up to 20-24 days, in a critical care environment. That's occupying a lot of beds for a very long time. So I think all countries are going to have to think very carefully about how they manage the critical care component of this disease.
Thank you very much. We will come back to the room, Bodhi, and then Gabriela.
Good evening. Felix TV from Hong Kong. Just to follow up on my colleague from India, some countries, probably in Europe, has underestimated this epidemic, and no transparency and probably ignored warnings to public. Do you have any comments on this? I'm sorry. And now has with mild discrimination against the Iranian or against the Italian, please give us some comments. Thank you.
Yeah, I think we've all been on that merry-go-round once before. We're not in the business of apportioning blame to countries nor to individual ethnic groups. All countries experienced this disease have been unfortunate victims who've been in the pathway of the disease. What Maria said before and the DG said before is we don't believe that countries are being non-transparent. There's an issue in the beginning of any outbreak. When something starts, it's very hard sometimes to distinguish that from all of the other background of winter influenza and other things. And sometimes it's difficult to pick up that signal of what's happening.